Most people who go into family medicine because they want to provide primary care for an underserved population. That's why I went into family medicine.
What I'm passionate about specifically is being able to be like the all-around kind of doctor. I really would like to help the community be healthy as a whole.
And it's the diversity of the patients that we serve that is unique as well.
My name is James Mumford. I am the Family Medicine Residency Program Director at Glen Cove Hospital. The Glen Cove Family Medicine Program is really looking for a diverse set of residents.
We seek people that have a passion for medicine, a passion for family itself, and a passion for being part of a community.
What I love about Glen Cove, the beautiful area, and it is a really warm community.
Glen Cove Hospital is located in a fairly affluent area of Glen Cove, but our patients are not the patients who live in the big houses. We like residents to be able to communicate well with our patients who are largely Spanish speaking. We would like them to be interested and enthusiastic about care for underserved patients.
Not everybody expects that in Long Island we serve an underserved population, but we do.
We don't turn away people, and so even if you have no insurance, this is still a place for you to come and be able to get the quality service that you deserve.
At Glen Cove, when we're interviewing new residents, there are three factors that we consider. There's knowledge, there's skills, and then there's attitude. We're looking for people who really want to do this.
They come here ready to work, ready to identify themselves with the patient and the need of the patient.
If you're passionate about family medicine, you want to work with an underserved population, then you're a good fit for this program. We have a lot of international students. We have a very diverse residency class.
I'm a foreign medical graduate. I studied medicine in Cuba. I found that Glen Cove Family Medicine Residency program had a lot of what I was looking for in terms of diversity of the population that's treated here.
The Glen Cove program has 7 residents in each year, which is a total of 21 residents. The faculty here has 4 full-time positions and 1 part-time position.
Since it's a smaller hospital, we work as a group, as a team, and that's what's like the best thing of it.
Each resident will be assigned a faculty advisor who's available to provide mentoring for them, but if they have a particular interest, they might find another faculty member who has some more experience in that area, and they can partner with them for specific goals.
The mentorship here in the program, I would say, is really good. I feel that working as a resident here, you feel very supported early on.
One of the things that we try to do here at Glen Cove is offer people an individualized education plan that takes advantage of a person's particular interests or skills. Residents have a lot of elective time and they can do almost anything they want.
We have preset tracks, but if there's anything that you're interested in, you can almost immediately do an elective in it. And we have really good quality physicians within the Northwell system, so you'll learn a lot on those rotations.
One of the strengths of the program here at Glen Cove is that we have access to the entire Northwell system for opportunities for learning.
Being part of the Northwell umbrella is actually pretty amazing because we get to basically have carte blanche in terms of what we want to do and who we want to work with, which is really great because Northwell is a huge system. And so if there's any experience that you really want to seek out, Northwell definitely has it for you.
The Glen Cove Family Medicine program utilizes the ambulatory site here at Glen Cove Hospital. The majority of our inpatient rotations are done at Huntington Hospital. We want to provide a very strong background in inpatient medicine, but also a very independent kind of practice in the ambulatory setting.
I would say our clinic here at Glen Cove Residency Program is the heart of our program.
Once you see that the patient trusts you, you are able to actually extend yourself to the patient and understand their problems to the point that they're going to come to you for anything that they have.
For me, I've always been interested in teaching, and that happens here all the time.
We have medical students come from the Zucker School of Medicine, and they rotate with us. And there's something about teaching a medical student that you learn things yourself in a way that there's no other way of learning it.
The Glen Cove program does require research for all residents. There is access to the entire Northwell system in terms of collecting data sets or even expanding your research to a broader cadre of patients.
We get a great deal of support in designing our research projects and implementing them. Right now I'm working on a project trying to improve our online electronic medical record systems.
We like residents who are interested in advocating for family medicine and for patients and who are willing to be active in regional and national organizations.
I actually am really interested in advocacy, and that's part of the reason why I chose to come here. They actually do have a leadership and advocacy track.
The Northwell system is big in advocacy.
It means that we can change the environment for entire populations.
Wellness is one of my favorite things to talk about because I think that Northwell really does promote wellness, and they don't just talk about it, they take steps to make it happen.
We have incorporated 1/2 day off per 4-week block, and you can do whatever you want. If you need to take a nap, that's fine. If you need to get your oil changed or go see your doctor.
It's actually really nice in the fact that we have like a beach like 10 minutes away from here. There's like really cool restaurants.
We have monthly activities that we do in order to build teams and provide resident wellness.
Just earlier this year, we did an escape room nearby. It was so much fun. We get to know each other. It makes coming to work very welcoming.
The camaraderie that we have between the residents promotes the wellness of the residents in this program. So we're fortunate to have subsidized housing. It's right across the street from Glen Cove Hospital. Most of the residents live there, and we have a courtyard in the middle with a place to barbecue, hang out, and talk to each other at the end of the day.
It makes it very easy to come to work. If you have a late night, you're working on research with someone just right across the street, we can safely go home.
It's actually a really big plus. You were living with all the residents, so if you have a question about how a rotation can go, someone can always help you out. Being able to have people who understand you and want to support you is really important. I think we have that here at Glen Cove.
I'm a graduate from this program. I graduated in 2002. I thought it was the opportunity of a lifetime to help the people, the community that is here. I'm still seeing now patients that I delivered back then, they come back, and it's amazing just to have the familiarity. I took care of them as a resident and now as a director of the clinic as well with the residents that are here. It's a beautiful opportunity here at Glen Cove.
Residency is 3 years of your life. Finding a place where you're happy, it's worth it. I like being in a hospital where we have fun in an area that's gorgeous. I really do love it here.